The United States spends more on healthcare than any other country in the world, yet tens of millions of Americans remain uninsured or underinsured, forced to navigate a system plagued by astronomical hospital bills, denied claims, and financial ruin. The primary culprit? Private insurance companies which act as profit-driven middlemen, extracting billions from the system while offering little to no real value to patients. This article explores how private insurers inflate costs, exploit patients, and enrich their executives, while also providing a roadmap to transition to a single-payer healthcare system, a model that most developed nations already use to provide better care at half the cost. Currently, U.S. healthcare spending comes from three major sources: government spending, Medicare, Medicaid, Virginia, etc., around $2.2 trillion per year; private health insurance payments, employers and individuals, about $1.3 trillion per year; and out-of-pocket expenses, deductibles, copays, etc., roughly $450 billion per year. The total annual healthcare expenditure in the U.S. is approximately $4.9 trillion, equating to 17.6% of the GDP, a significantly higher percentage compared to other wealthy nations. Administrative waste and inflated costs. A staggering amount of U.S. healthcare spending is wasted on administrative costs, between 15 and 25% of total national health expenditures. Private insurers create unnecessary bureaucratic hurdles that require hospitals, doctors, and clinics to maintain entire departments just to process insurance claims, navigate denials, and negotiate payments. A 2021 McKinsey study estimated hospital administrative costs at $250 billion and clinical services administrative costs at $205 billion, representing nearly a quarter of all healthcare spending. In contrast, countries with single-payer systems, such as Canada, the UK, and Germany, have administrative costs below 5%, because there is no need for an army of insurance claims adjusters and billing specialists. CEOs and executives enrich themselves while patients suffer. While millions of Americans skip medications due to cost, private insurance CEOs take home obscene salaries. Cigna CEO David Cordani, $91 million in total compensation, 2021. United Health CEO Andrew Whitty, $20.9 million, 2022. CVS Health CEO Karen Lynch, $21.3 million, 2022. These CEOs are not medical professionals. They are corporate executives whose primary job is maximizing shareholder profits, often at the direct expense of patient care. Meanwhile, Americans face denied claims. Insurers reject valid treatments, forcing patients to fight for coverage, surprise bills. Even insured patients are hit with massive unexpected medical bills. Medical bankruptcies. 66% of bankruptcies in the U.S. are linked to healthcare costs. Hospitals overcharge because insurance companies enable it. Hospitals inflate prices because they negotiate with insurance companies, not with patients. A simple procedure might cost $20,000 in the US under a private insurer, $5,000 in Canada under a single-payer system, $3,000 in Germany, which uses a heavily regulated universal system. Without insurance companies creating artificial pricing schemes, costs would drop dramatically. But insurers have no incentive to lower prices. They simply pass costs onto employers and consumers while pocketing more in premiums. Different estimates vary, but Medicare for all, or single-payer healthcare, would likely cost between $3.5 trillion and $4 trillion per year. That's actually less than the $4.9 trillion currently being spent. A study by the Mercatus Center estimated a 10-year cost of $32 trillion, or about $3.2 trillion per year for full, universal coverage. The Political Economy Research Institute, or PERI, estimated $3.78 trillion per year, but with overall savings due to reduced administrative costs. The Urban Institute estimated that a fully government-funded system would increase federal spending by $34 trillion over a decade, but would replace existing private and employer-based spending. First, expand Medicare to cover everyone. Rather than forcing Americans into private insurance plans, Expand Medicare in phases. Lower the eligibility age from 65 to 55. Expand coverage to all children under 18. Include vision, dental, and mental health services. Within 5 years, eliminate private insurers entirely. Next, fund the system through progressive taxation. Instead of private premiums, Americans would contribute to healthcare via taxes, but the average household would pay less than they currently do in premiums. A new payroll tax of about 4 to 6% would replace insurance premiums. There would be a wealth tax on billionaires who profit from the current system, and higher corporate taxes. Since corporations currently pay billions in employee insurance costs, they would actually save money. Finally, regulate hospital prices and drug costs. Under single-payer, the government negotiates drug prices and caps hospital billing, ensuring reasonable rates. For instance, a heart surgery that costs $150,000 in the US could cost $15,000 under a single-payer system. Medications that cost $500 a month could be negotiated down to $50 a month. The current U.S. healthcare system is a for-profit nightmare, where private insurance companies profit off suffering while patients go bankrupt trying to stay alive. Medical bankruptcies would disappear under single-payer. Administrative waste would shrink, saving hundreds of billions annually. Every other wealthy country spends half as much and provides better care. We already have the resources. We just need the political will to cut out the middlemen, regulate prices, and prioritize people over corporate profits. It's time to stop asking, how can we afford universal health care? And start asking, how can we afford not to?